Opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Happy Thursday, everyone. Hard to believe we're in the first week of August, unless you're local in South Florida and you know how hot it is outside. I'm Dawn Graubert. I'm filling in for Louise Gomez tonight on You and Your Doctor, sponsored by All County Healthcare. You can listen to us on True Oldies 95.3, 96.9, all over your streaming platforms. I'm very excited tonight because we get to work with Tracey Leschinsky, a new guest of the show. And if any other questions while we're doing the show, you can give us a call right here at the station at 888-994-4995, Studio A, to call in, ask Tracey direct questions, or to get in touch with All County. Afterwards, if you want to get in touch with All County, you can find them at 954-717-7027. But for now, we're right here live on the radio station. So Tracey, I am so excited. I've got Tracey Leschinsky. She is a certified nurse practitioner joining us. And I asked her while we were getting ready, what does the C stand for? Not only is it certified, but there's a reason for that certification. So welcome, Tracey.
Thank you for having me.
I want to get started before we even go into that, why the C is so important for a nurse practitioner.
So without having that C after the name, it means that we cannot bill Medicare. So Medicare is, one of the biggest populations down here, and without that board certification, we can't see those patients.
We've had a lot of things to get into. We've had a lot of equipment here on the set, but I want to go into your background a little bit. Tell us what type of, when you started in the ER and how you are where you are now.
So I started in the ER, was encouraged by a couple of the doctors that I work with to go back to school and become a nurse practitioner, and thankfully I took their advice. And now it's 18 years later. So I started out doing internal medicine, worked that for 12 years, and decided I needed a change and went to practice in urgent cares. So it kind of brought back the ER that I was missing. And one of the managers asked if I could come stay with her for a day in a pain management office. And I absolutely loved it. And that was back in 2017. And I've been doing pain ever since.
What's different between a nurse practitioner, a registered nurse practitioner, and a nurse compared to a physician? Where do you fall within this spectrum?
So, really good question. So we kind of fall in the middle. We have more background than nursing, so we can do all the things that nurses do. But we also can do things that physicians do. We prescribe medicines, we diagnose, we treat patients just like a physician would. But I would say that we bring the nursing background into it and kind of look at the whole picture for the patient versus just one part of that person.
And what really liked when I got to talk to you when you first got here was why you love doing this so much. Because you were in ER, you were all the way up in management, and you said to me, that wasn't for me. Why is that?
I love working with patients, and pain management, especially in South Florida, is something that is really difficult because there's a huge population of people that cannot get to a doctor's office, and those are my patients. So I go to assisted facilities, skilled facilities, I go to their homes, wherever they need, because I don't want them to feel they have to come to an office. And everything that's done in that doctor's office can be done in the comfort of their own home.
This is what's the amazing thing. NP to you, so easy to remember. It's like it sounds. NP, the number 2, and the letter U. So all of you that are listening to us on the radio, NP to you, you can find them anywhere that they're listed on social media, Google. But what Tracey does is she goes to the home, or she goes to a senior facility, or you go to a nursing home. So when mom and dad need pain treatment, you don't have to worry about calling the ambulette. You don't have to worry about scheduling the doctor's appointment, getting clearance. How about referrals?
So a lot of times they do refer if they go into a facility and they find that they were seeing somebody before. It's just easier to bring me in and see the patient, but I do take on new patients. So I do a lot of things that other practitioners don't. So I can do joint injections, nerve blocks, epidurals, facet injections. I use medication treatments. I do neurostimulators. I order physical therapies and things like that. So everything can be brought to the patient.
You specialize in pain treatment.
Correct.
People wouldn't call you in because they need a prescription filled necessarily. You've got another niche market.
Well, if they do need a prescription, I can do that for them. That's the easy part.
Right.
But that's kind of where I look at things a little bit differently. If there's something that I can do to make a difference in their pain so they don't need to take a pill, that's what I'm looking to do.
So what I love, again, I'm loving everything that you do from NP to you, is that not only will you help with the prescriptions, but think of the opioid epidemic we're having, right?
Horrible.
And people that are consistently on chronic pain meds, even through COVID and all of these long-term COVID issues we have, phantom pain. Here you are helping with pain with two types of treatments.
Two modalities, yes.
Which modality do you want to start with?
So first thing I do is I use an ultrasound. So I use this ultrasound to do ultrasound guided injections, spine injections, regular joint injections, so shoulders, hips, knees. And I also use this to do nerve blocks. So there are multiple ways to treat pain. So you don't have to go to an office to have that done.
This comes with you. So
This
you
comes
take this
with me.
into someone's home,
Take it in
or
their
a
home.
facility wherever mom and dad are living. And what does this do? How do you hook this up?
So just as it is now, no electricity required. I have it strictly on battery power, and I use the probe and transducer gel and use it just like I would any other tool. The nice thing about this device is that the injections are within a millimeter, so the chance of me missing is 0. So I guarantee that they're gonna have pain relief.
And I want to go back to the type of pain injections you do. So it's not just knees or hips, right, or shoulders, bursitis.
Right.
You go deep
I can also do facet injections in the spine and epidurals in the spine with this device.
all from wherever anybody is.
Yes.
All right. So here's the important thing: because you have the C on your certification, on your title, you can bill Medicare.
I can.
Is this covered on Medicare?
Absolutely. When they have Medicare with a secondary, they never get a bill from me.
100% covered.
100% covered.
So imagine mom and dad or you're in pain. You can't even leave the house, right? There's been times that you're in so much chronic back pain. Well, come to the office. You can't. You can't even get in the car. You can't even get an appointment, right? You are on bed. Call you.
Yeah.
Now, what if we don't have Medicare? You take private insurance?
I do take some private insurances, and I also do, if I'm not on their insurance, then I'll do a cash pay patient level, and they can submit that bill to their insurance to get reimbursed.
I'm just amazed because there's so much in the opioid use, right? And what happens is you're on chronic pain meds, you can't come off of them.
Well,
right, unless you go
I
through
can
treatment.
fix that too.
You can fix that. I feel like I'm doing an infomercial. You can fix that too.
I can fix that too. So the second device that I have, really super exciting, is a neurostimulator. And the neurostimulator is programmed to the patient. So if they are having issues with opiates and they're having pain, I can program the device, which is super, super tiny, to that patient so that they can get pain relief as well as they can come down on their opiates.
I love this. I am a big believer in alternative medicine. So I use a lot of acupuncture. This to me reminds me, I know it's different, we're going to talk about that, when you do the auricular therapy and you'll put in the needles, right? Because they always say that your ear is really an upside down fetus, right? So if you treat the ear like an upside down fetus when it's in the womb, it hits the different points, the body points.
Correct.
Is that how this works as well?
It's similar. So we use the ear to basically channel to the brain. And we have 3 leads that are programmed specifically for what that patient needs. So it can be for, as I said, for pain, different areas, and for opiate reduction.
How does the ear signal the brain more than where the pain is? Say it's your knee. Why would it go on the ear, not your knee?
So that's kind of how it works. Everything's connected to the brain, and that's where the pain signals originate from. Yes.
So this goes back here.
Correct.
Right? And then these wires, these leads, are almost like an EKG machine, right? And they go into these little pins that
go into little pins
around the ear
that are placed onto the pinna of the ear, right on the outside of the ear.
You use all 4?
All 4 are used. There's 1 ground, and then there are 3 leads that are programmed for the patient.
Let's see if they can get this on the screen a little bit. I can see they're out here. These leads, and how long does this last for?
So when it's programmed to the patient, right now, average time for, like, how long does it last for pain relief, or how long before it kicks in?
Okay, you tell me. Where do you want to start?
So
yes.
Patients usually say to me that they start feeling relief within 48 hours of starting treatment. So the device goes, when the device is placed, it immediately starts working once the batteries are activated, and they go in cycles of 2 hours. So 2 hours on, 2 hours off. Sometimes the patients tell me they feel it, sometimes they tell me they don't. A good majority say that they don't feel it, but typically within 48 hours, they just feel better.
All right, so how do you program for the different body parts, or what the sensation is that you're trying to help?
So that's what this is for. So this device programs with the machine that's underneath it and is connected. And then once the device is placed on there and programmed to it, that's all, and then it's hooked up to the patient.
Back pain, hip pain,
anywhere that you have pain in the body,
pain.
Pelvic floor dysfunction, shoulder pain, chronic headaches, whatever it is, CRPS, which is literally impossible to treat, we treat.
Pelvic floor dysfunction. All right, explain what that looks. I mean, I know what it is, but how does this help dysfunction?
So the people typically that have pelvic floor dysfunction have chronic pain. So moving their bowels or urinating causes them pain. This will help shut it off.
And then we've got something else we're going to talk about when we come back from commercial break, because I asked you about incontinence and using this, but we're going to talk about some other aspects of what you do.
Okay.
Before we do that, what's the best way for people to contact you directly, though?
Right on the number, it's 561-901-1182.
NPTU with Tracey Leschinsky. This is so amazing, and if you're looking for an alternative, or to work with your medications, or to work with your physician, and you just don't even know what to do anymore, you're in so much pain, and they're bumping up your meds, and whatever contraindications that has with another med, and you think it's making me sick. I mean, as we get older, it's medication after medication, and some people need all those meds. But imagine if you can help bypass some of that and get more relief without some of the side effects.
Yes.
That's what's amazing.
Yes.
All right, we're going to take a quick commercial break. To reach out to All County, it's 954-717-7027, and we're right here at the studio, 888-994-4995. Studio A, call in, ask Tracey any questions that you have. When we come back, we got some other exciting information for you about PRP and some other modalities that she uses. More to come, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, and welcome back to You and Your Doctor, sponsored by All County Healthcare. You can contact All County at 954-717-7027. But while we're on the air, give us a call right here at the studio, 888-994-4995, Studio A. We're here with Tracey Leschinsky, certified nurse practitioner. We're talking about pain management and the different modalities. We've talked about guided ultrasound injections. We've talked about these neurostimulators.
And one of the things that we didn't talk about is how long the pain relief lasts with these neurostimulators.
Let's talk about that, and then I want to see how long Medicare how many treatments Medicare covers.
So from the patients that I have treated, most people are seeing over a year of pain relief from this device.
One treatment?
One treatment lasting well over a year.
And you told me it stays on for about 2.5 weeks.
Stays on for 2 weeks.
And with that, it could have a year to a year and a half of pain relief.
Relief, yes.
How do you, I know you program it through here.
Correct.
How does it reprogram the brain? What's the whole mechanism behind it?
So because of the cycling, how it works, the 2 hours on, the 2 hours off, that basically works off of brain plasticity, that the brain can change. So it basically reprograms the brain so the brain doesn't know it's in pain anymore.
Because the brain knows what it's learned, so you're retraining the brain.
Correct.
To feel something different.
Correct.
And this works with addiction as well?
It does. So a lot of times, one of the big things that I'm battling is that these people are also on lots of opiates. So one of the things that I do program this for when I do that for patients, if they are on opiates, is for opiate reduction. So far I'm about 75% reduction in the amount of opiates that they need. And my worst success has been 50% reduction in pain.
That's amazing. So what do your clients say? What are your patients saying when you come in with this treatment?
Most of them are skeptical. They don't understand how something so small can work and work that fast. And it's amazing when I go back and, I haven't been able to use my shoulder since the surgery. It's frozen, I can't do therapy. And I go back and I always call in between and how are we doing, what's going on. And by the time the removal comes, I get things like, well, I was out washing the car with my arm. Stuff that I couldn't do before, I now can do.
You can help with a frozen shoulder also?
Correct.
My dad's shoulder arm only goes up to here.
Mm-hmm.
You can't do anything, right? So you can potentially help with that as well.
Yes.
So that's more than pain. That's range of motion and mobility.
Mm-hmm. So that actually we can fix with ultrasound.
With an injection, and you put all these modalities together.
I do.
Now, both of these are covered by Medicare.
So both of the neurostimulator and the injections are covered by Medicare, 100%.
And what hospitals are you on staff with?
I am affiliated with Delray Medical Center, and I work with an amazing physician there, Dr. Giacino, who has a practice in Lake Worth. So there is an office.
Okay.
If a patient is really that they need to go to an office, there is an office that I'm associated with.
All of these modalities are fascinating. And you were talking about pelvic floor dysfunction before, and I asked you, does it help with incontinence?
So this has helped with pelvic floor dysfunction, but I also use another modality called PRP, or platelet-rich plasma, to help with pelvic floor dysfunction, because we can inject PRP and basically cure the incontinence.
Okay, so yes, ladies and gentlemen, I did ask where we get injected on the PRP. All right, so I'm going to let Tracey explain this.
So we can do lots of things with regards to that, but basically we inject right through the vaginal vault, and it basically strengthens up the floor where the bladder rests and lifts up the bladder without having to do surgery.
It strengthens the whole pelvic floor of the bladder.
Yes.
And how quick does that work, and how long does that last?
So results are pretty instantaneous. As long as they're doing their Kegel exercises, it should stay.
You draw the blood from the patient,
Correct. We
spin it down on site, so
Yep.
it's all done within the same treatment day,
Absolutely.
and then you inject it.
And we inject it right in.
And then it goes right into
So for men, we use it for erectile dysfunction. So for that, we do use ultrasound because we see if there's anything that's causing their erectile dysfunction,
like a blockage or something.
like anything that's venous or arterial that's causing the problem, and we can actually fix that with PRP.
This is fascinating.
Yeah.
All right, so what is your typical age range of patients? Who do you treat?
So I've seen patients anywhere from their mid to late 30s. In the hospital, I see, I even see children in the hospital, so because we are a trauma facility. So I see pretty much the whole gamut,
What do you do with kids?
Well, when children are in trauma or crisis and they need pain management, we help them too.
So you work with everybody.
We work with everybody.
All right, so I know you love patient care. What about this do you love so much? What about these modalities, the ultrasound and the neurostimulator?
It makes
Because I'm watching you light
such a
up.
difference. It's such a difference when people are not in pain and they're not a slave to a pill. It makes their whole world better. I had one patient in particular. She was a hospice patient, and I was told by hospice that she wasn't going to make it. And she was on so much morphine, and I did a neurostimulator from her. It's a year and a half later. She is off of morphine. She is going out every night for dinner, and she's a different lady. The family didn't recognize her.
Wow.
Because she was so different. And this was a lady that was on hospice.
Because you don't realize what pain does, because pain is more than the physical pain.
Yes.
Pain affects every aspect of your
does.
life, right? It causes depression, anxiety. You don't want to leave the house for fear of. What about chronic migraines? Can this help?
It can, but there's other things also that we can do for chronic migraines that can make things go away. But yes, this absolutely can help.
We just had a phone call with someone. He was at his doctor getting some Botox injections. And I know someone else who doesn't leave her house for fear of when that migraine might kick in. So what are some modalities that you have for that?
So we can do an occipital nerve block using the ultrasound. That's one modality. We can do a sphenopalatine ganglion cyst block. We can use the neurostimulator. There are so many treatments that are open for migraines.
All right, so you got to give out your phone number again, because people are, and just people in my demographic, we're not even talking about seniors that will pay, whether they're insurance or not. When you're in that kind of pain, you find a way to function.
Yeah. So my phone number is 561-901-1182.
These are fascinating. There's so many things to talk to you about. But the other thing is you're the only one within 250-mile radius.
Yep, that has the neurostimulator.
All right, how did you get such a win-win on this one?
So the company that I worked with that supplies it, I had a conference with them. The device has actually been out for over 10 years. I don't know why it hasn't gotten more traction, and I'm kind of glad because now I'm the only provider that has it, which makes things even better. But the contract that I signed with them basically says that I am the only provider in a 250-mile radius for the next 2 years that can have this device in this area.
So you pretty much cover all of Southeast. You even go into Central. 250 miles is about 4 hours, either direction from here.
Yep, but I will go, if somebody does need a stimulator, I will go to them.
Well, that's the beauty of it. If you're 4 hours away and you're in chronic pain and you can't find somebody to help you and you can't get in your car or find transportation, you're going to go.
Yes, but I will say this. I also have patients that have flown in and have stayed here in hotels for me to do this for them. I had one that flew in from Georgia. I had one that flew in from Colorado. So
NPTU, 250-mile radius. And the guided injections, that's another incredible opportunity.
yeah,
Because when you're getting an injection, you're going for an epidural or a facet. If it's not under guided ultrasound and you miss that one point, it can be close. You're not going to get any relief.
correct.
And how long do you think that pain injection will last?
Most patients that I see when I do like a nerve block or a spine injection, not only is the relief immediate, it usually lasts, I don't get calls back. 6 months, a year is when they start feeling pain.
Is there still that 3 or 4 per year that insurance covers?
So With spine injections, yes, they cover 3 to 4 a year, depending on the patient, yes.
Well, then it seems like the auricular neurostimulator is a win-win,
Yes,
right? Because if you're getting pain relief for about a year to a year and a half, you don't need to go back for 4 injections, 3 to 4 injections a year,
correct,
and it's no medication,
correct.
and it's reprogramming your brain.
And
Does
there
it-
are no side effects.
And there's no side effects.
So most people that are on narcotics have issues with constipation and can't drive on the narcotics because that's considered being under the influence. You're not under the influence with this.
This is fascinating. Tracey, it has been such a pleasure to get to talk with you. I've heard about you. I've heard your commercials play on the air. NPTU with Tracey Leschinsky. Let's give out your number again.
561-901-1182.
Wow, and thank you to All County Healthcare for having me fill in tonight for Louise Gomez. For any information you need for All County, you can contact them at 954-717-7027 for all of your healthcare needs. Have a great evening, everyone, and we will see you again next week. Bye-bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call